Hello again. Ebola cases continue to rise in Uganda. The country has since recorded 63 cases and 29 people have died, including healthcare workers. Ebola spreads through body fluids and has a high mortality rate. The Ugandan outbreak is caused by a Sudanese strain of the virus, and the race is on to find an effective vaccine. eNCA's Uganda Correspondent Isabel Nakirya joining us now live here on Today from Kampala for an update. Isabel, very good afternoon to you. Welcome to Today. Thank you very much for your time. Can you give us the latest update, whether it's the numbers and how is the situation looking now in terms of the outbreak?
Thank you, Dan, and good to have you. The latest is that this afternoon, the Ministry of Health discharged 5 more patients who were suffering from Ebola. This included 3 doctors, and they were discharged from a hospital just about 40 kilometers out of Kampala, that is in Entebbe Hospital. We are told that these patients were evacuated from Mubende district, which is the epicenter of the outbreak. That's where the outbreak started from, and brought to Entebbe to receive specialized care. These were health workers who were working at Mubende Hospital and contracted the disease after caring for patients there. That is before they discovered that it was actually Ebola. We also know that some of the CDC, that is the Center for Disease Control, and the WHO are training more officers to help in disease control and, control of the outbreak. The government says that the outbreak is under control despite the fact that countries are issuing travel restrictions. We have seen the USA issue travel restrictions for travelers from Uganda, directing planes to certain airports in the US for the travelers to undergo specialized, screening before they are allowed in the US. The neighboring countries too have started screening people going in and out of their countries. And of course, the tourism sector is also beginning to feel the pinch. Travel agents are saying that travelers or tourists are cancelling, their travel to Uganda because of the scare of Ebola. But the government says that the outbreak is under control and people can visit Uganda freely because, the people with the Ebola cases are out of the capital and out of the tourism sites in the country.
Yeah, in my introduction, I mentioned 63 cases, and you've responded by saying that a number of people have also been discharged from hospital today. Do you have an idea how many cases now are positively Ebola as we speak in Uganda?
The cases are varying. The WHO has higher cases and the Ministry of Health has a little bit lower case. The Ministry of Health says there are 48 confirmed cases and the WHO is a little bit higher. This is because the WHO is going according to cases that people who died of who are suspected to have died of Ebola before they were confirmed to be having Ebola. Meanwhile, the Ministry of Health is only numbering the cases of people who are confirmed with Ebola. So those are where the variations occur. But so far, we know that over 1,000 people are being followed. These are people who may have gotten in touch with people who are suffering from Ebola and are under isolation. We also do know that about 14 people have recovered and 17 deaths have occurred since the outbreak on September 19th. But it seems like the cases are going up because many of the deaths that occurred before the confirmed cases were confirmed died and they did not know that this was Ebola. So some people contracted Ebola unknowingly, and of course it's spreading into some other districts. So far we know that about 5 districts in Uganda, that is within the central part of Uganda, have registered cases, though the Ministry of Health says contact tracing is going on, and they have so far gotten 1,000 people who are in isolation, and the outbreak is under control.
Yeah, I know that so reports that on Monday there was an arrival of a delegation from the WHO, World Health Organization, in Kampala. I mean, in addition to training, as you said earlier, very briefly, if you may, Isabel, what other support, assistance are they bringing to the health ministry, the health authorities in Uganda to assist them in keeping Ebola under control?
In addition to the 60 health workers that are being trained, those are village health teams that are within the villages spreading the word of Ebola, talking to people how Ebola is spread, how they can control it and contain it. The WHO and the Centers for Disease Control are also helping in the control of the disease. We know that they have delivered equipment, a lot of treatments, and a lot of equipment that the Ministry of Health teams are using in the isolation units in the different parts of the country. So there is a lot of partnership between these organizations, and we are told that they will be helpful much in the control of the disease.
Thank you very much, Isabel Nakirya.